Hey, Rashmi, it's been so long. It's so good to finally see you, dear.
I know, dear. So sorry for not making time earlier, as I was busy juggling time between hospital, work, and home.
I can understand. Akash told me about your cancer. How are you now?
Well, I am better now, just taking one day at a time.
You're a great fighter, Rashmi. But tell me, how did it all start? And did you notice any symptoms earlier?
Yes, in the beginning, I had abdominal pain and digestion issues over 2 months. So I visited my family doctor to get it treated. After a few days, when I did not get any better, my doctor recommended that I should see a gastroenterologist. That is when they detected my ovarian cancer was causing the trouble. You know, Natasha, the problem with ovarian cancer is that it is a silent killer. Its symptoms are similar to common illnesses that we tend to ignore.
Gosh, Rashmi, cancer sounds so scary. How did you handle everything?
I know, Natasha. In the beginning, I was worried too. But later, I learned that cancer is not a death sentence anymore. To be honest, when I learned about my cancer, I was a total wreck. But my oncologist guided me well. Looking at my reports, he recommended that I should see a genetic counselor and take a BRCA test to find out if my gene had any mutation. The genetic counselor then described the testing procedure, took my medical and family history, and explained how the test results might affect my treatment course.
Oh, but Rashmi, what is a mutation?
A mutation is a change that occurs in our DNA sequence, either due to mistakes when the DNA is copied or as a result of environmental factors.
Also, what is this BRCA you mentioned earlier? And how is your cancer related to it?
So, the BRCA gene in our body has an important job. The BRCA gene produces a specific protein that prevents cancer growth in our body.
Ah, now I get it. Since there was a mutation in your BRCA gene, your body could not stop ovarian cancer, right?
Sadly, yes.
But how is this test helpful in your cancer treatment?
This test is a game changer for ovarian cancer patients. Once they identified my BRCA mutation, I was put on a targeted therapy that focused on killing only the BRCA defective cancerous cells. The best part about targeted therapy is that healthy cells are not damaged in the process.
Ah, this is reassuring. But I'm still curious. So is a BRCA mutation test for all ovarian cancer patients?
Yes, based on the doctor's recommendation, every ovarian cancer patient should undergo a BRCA mutation test.
Ah, got it. That reminds me, my friend Ritu is battling advanced stage ovarian cancer. I wish she knew about this test earlier.
Well, it's still not too late. Ideally, an early test is better. But this test is done at any stage of the treatment. So please ask her to go for it. In fact, according to studies, the BRCA mutation also indicates if one is susceptible to developing breast, ovarian, prostate, or pancreatic cancer.
Oh, so you mean that a BRCA mutation test can be taken by men as well?
Yes, the test is for both men and women.
That is amazing. I will inform Ritu tonight itself. But tell me, is the test painful?
No, not at all. The test is simple and can be done with the blood sample or with a saliva sample or even with a tissue sample taken during surgery.
Ah, that's great. Rashmi, but I was wondering, is your daughter Sia at the risk of developing cancer too?
You know, Natasha, I had the same fear. Doctor, what are the chances of my daughter Sia developing cancer later in her life?
That's a good question, Rashmi. Let me explain the 3 possible test outcomes. A BRCA mutation test result can either be positive, negative, or VUS, that stands for variant of unknown significance. In case of a positive result, it can either be germline or somatic. A germline mutation means that a patient received defective genes from their parents. In that case, the patient is likely to further pass on the BRCA mutation to their kids as well. Thankfully, that is not the case with you, my dear. Your mutation is somatic, which means that it is not hereditary, but it developed later in life. Somatic mutations do not pass down to the offspring. So, Sia is not at risk.
Thank you so much, doctor. It is the best news I've heard today.
What's also a relief is that your test result is not a VUS. VUS indicates a genetic mutation that has no records, so its clinical significance is unknown. Understand? I'm glad to know that Sia is not at risk.
While we are on the topic of BRCA, did you know that Angelina Jolie was identified with a BRCA mutation as well?
Oh, Angelina Jolie too? I had no idea.
Yes, her mother was a cancer patient, so she got herself tested too. Once her results were positive for the BRCA mutation, she got both her breasts removed surgically to reduce her risk of developing cancer.
Oh, so Angelina Jolie's BRCA mutation was a germline one, right?
Bingo! Natasha, in one evening you have become quite the BRCA expert yourself.
I'm only learning from the best. But on a serious note, this BRCA test is sure to save lives. And I'm glad that you have a great treatment plan in place. But remember to take care of yourself, huh?
Thanks, Natasha. Don't worry. I have great doctors who have my back. All you have to worry about is our summer trip to Bali.
What? Are we still doing it?
Absolutely. My doctors have promised a better quality of life by summer. All you need to focus on is getting back into shape.
I promise to go on a diet right after I finish this slice of cake.
Not if I beat you to it.
Oh God.